Hello everybody, welcome to the Thursday edition of Video Clips. I have a couple things I want to talk to you today about. One is, according to a new meta-analysis, cognitive behavioral therapy, or CBT, is better for treating both anxiety and depression than no treatment and better than treatment as usual, regardless of how it's delivered. This held true for self-guided CBT, CBT delivered by telephone, computer, or face-to-face. Now, you've heard me talk about CBT quite a bit, and in fact, at our upcoming conference, William Lessler, our CBT guru, is going to be talking about how he uses CBT to treat all kinds of conditions, ranging from attention deficit disorder to schizophrenia, without drugs involved. So anyway, back to the study. It was conducted by researchers in the UK because there was a decision made in 2008 to increase access to psychological services with a focus on CBT. And the reason was efficacy, and in addition to that, the researchers said that providing CBT is economically viable and that the increased rollout of multimodal CBT in primary care seems justified. So it's very effective and it is very inexpensive. Now, it's been used for hundreds of years. The Quakers were using CBT in the mid-1800s to help people with schizophrenia. It wasn't always called by that name. But as I mentioned earlier, doesn't cost much, works quickly, very low recidivism rate. And on the other hand, traditional therapy can be very expensive, time-consuming, and lots of times does not produce such very good results. Psychiatric drugs, well, my gosh, you guys have been hearing me rant and rave about that for a good long time. We just finished the advanced study course in the month of October on Robert Whitaker's book, Anatomy of an Epidemic. I really encourage you to read that book. I think it's an amazing book that really shows how ineffective and inadvisable these drugs are. Well, this article isn't the first that has suggested that CBT can be effective even when a therapist is not involved or face-to-face with a patient. A couple of things I'll just mention. Dr. Peter Breggin, a psychiatrist in Ithaca who's written 20-some books on the inadvisability of using prescription drugs and psychiatric drugs, he basically says we should get rid of all psychiatrists. He actually told me this. He said we should get rid of all psychiatrists and just take people who are empathic, teach them some CBT skills, and let them help other people. And you can read about his ideas on this if you go to peterbreggin.com, by the way. Recently, I spoke at a conference with Michael Roizen from the Cleveland Clinic, who's also on the Dr. Oz show, and he reported that the clinic was using some forms of psychological therapy delivered through computer programs and that sort of thing. So again, inexpensive and not necessarily having to involve a therapist being right there. Well, the biggest impediment to this idea gaining traction, actually there are two or three. One is there's not as much money in it. Let's face it, if the drug business, just for psychiatric drugs, $40 billion a year in the United States. That's a lot of money. So they're not going to give up very easily. The other thing is state licensure laws. And I don't want to go off on too much of a tangent about that, but healthcare practitioners like to hold on to their turf and keep other people from doing some of the same things that they do. It happens in other occupations too, but healthcare is notorious for it. And so the family therapist boards and social worker boards and medical boards, they don't like when other people start offering counseling type services. But be that as it may, I think the take-home point we want to have here is that cognitive behavioral therapy works regardless of who delivers it or how it's delivered, including just reading books on the topic. And it's a better way to approach addressing psychological issues than drugs and traditional therapy. All right, so while we're on the topic of what works best, let's talk about weight loss. The diet business, multi-billion-dollar industry, you guys know that. And the reason is we have so many people who need services, and a lot of these people unfortunately look for magical solutions, and there is no shortage of people who will offer magical solutions for weight loss. And a lot of the resistance, I think, is just it can't be so simple as just eating better and exercising and you're going to lose weight. So be that as it may, a new study shows that, lo and behold, eating better and exercising actually works better than drugs and supplements. We keep coming back to the research shows that this really works, this eating well and exercising. So during the study period, 56.9% of the participants were using non-traditional methods, and these folks gained an average of 4.9 pounds during the 12 months. Only less than 20% lost weight, and even less than that of the obese group lost weight. 21.9% of the participants used diet and exercise, some diet only, some exercise only, but all methods were inferior to diet and exercise as a combination. That was just the take-home point without going through all these hairy little details. And it didn't matter what the starting BMI was. It didn't matter the status of the people. They lost weight, more of it, if they did the diet and exercise segment rather than drugs and supplements. So the reality is, though, even though the weight loss was better for the diet and exercise group than the pill popping group, the results were pretty abysmal for all populations. Less than 20% of the entire cohort lost weight, and mean weight actually increased in all of the groups. So the author stated that weight gain was less in the diet and exercise group, and isn't it a shame we define success as less weight gain than other people, right? So I'm covering this study for a few reasons, and here are my take-home points from it. First, no magical solutions for weight loss. All right, so get rid of the drugs, read the side effects on the drugs, and I promise you, you will not take them. All right, the supplements, they're just plain useless. A few of them kind of harmful, but anyway, I'm sure it's easier to take pills than to eat better and exercise. It's just not a good idea. The second thing is that the study highlights the difficulty that we face as we try to lean down America, because it is just hard for people to lose weight, and a lot of them fail. And third, the people who were trying to lose weight by diet and exercise were not given the right information, because we know that if somebody can get this diet thing right, they'll lose 2 or 3 pounds a week until they reach their ideal weight. So the unfortunate part about this is that when people are not given the right information, they conclude at the end of the day that diet and exercise don't work for them and attribute their weight gain to other things. So the authors offer an explanation for this that I find really disturbing, that perhaps the method of weight loss doesn't matter, and what really does matter is good education about protocols and a lot of support. In other words, anything goes as long as people are given good instructions and the intervention involves enough follow-up. I really hope this idea doesn't gain traction, because it will result in even more people being harmed by silly diets and bad ideas. So I wish we could just get to the place in the medical field where we could acknowledge that some diets are superior to others. And we're not there yet. In fact, when looking at information online and blogs, medical blogs, that sort of thing, I consistently see articles that say we know diet and exercise are important, but we really don't want to take a stand on which diet is better. You know, we got to start taking a stand on some things. I don't think this not taking a stand is working out very well. So we've got to really recognize that there is a right diet for humans. We have to teach that to people. And as I was talking about on Tuesday, what Dr. Mandrola was talking about, we've got to find ways to reach people, and it is incumbent upon people in the healthcare community to come up with messaging that will inspire people and convince them to do the right things. So, take home point, diet and exercise better than the other magical solutions. Not a whole lot better unless you learn the right diet, the right exercise pattern. And I pride myself here that I think that's what we teach people. We've proven that it can work, and we'll keep putting out a consistent message. And some people tell me I'm persuasive. Maybe I'll work on trying to become more persuasive about some of these things. All right, that's all for today. As usual, pass this on to anybody who you think would benefit from watching it, and I'll be back to you on Tuesday with more news.